Greetings. My name is Renata Mikons. I work with the First Nations Health and Social Secretariat in Manitoba, and we're sharing some information with you today about kidney health and kidney screening. Information about an upcoming project, and a very important guest that we have with us is going to be working on this project in partnership with First Nations communities, and he's going to be telling you more about it. His name is Dr. David Collister, and he's an assistant professor with the University of Alberta. He is a nephrologist, which is a kidney doctor. Welcome, Dr. Collister.
Thanks for having me today.
I would like to begin by asking you a little bit about this program that is starting in communities. And we're starting with a few communities, and it has to do with kidney screening. Could you tell us a little bit about it?
For sure. So the project's called Virtual Kidney Check and Follow-Up. It's a research project that's going to answer the question about how to best screen for kidney disease in First Nations adults from across Manitoba. We're starting in 4 communities, including Fox Lake, Cross Lake, Wasagamack, and Swan Lake. And the goal is to screen over 3,000 patients who don't have pre-existing kidney disease to identify kidney disease early to start therapies. The project has a lot of different people that are involved, including researchers, clinicians, community organizations. So the First Nations Health and Social Secretary of Manitoba is just one, but we're also working with the Chronic Disease Innovation Center in Winnipeg, Manitoba, as well as the Seven Oaks General Hospital. I used to work there. We work with Dr. Paul Commenda and Dr. Barry Lavallee, who are a nephrologist, kidney doctor, and family doctor, respectively, who have experience in kidney health screening in First Nations communities across Manitoba. So it's leveraging and working and expanding the work that they've done over the last 10 years in Manitoba to find kidney disease early and improve health outcomes in First Nations adults.
Mm-hmm. So for those of us that are not really sure about what kidney screening is, could you tell us a little bit about what kidney screening is and why it's important?
So kidney screening is important because kidney disease is very silent. It's not until you've lost over 70 or 80% of your kidney function that people start having symptoms related to kidney disease. And that's because the toxins that the kidneys normally clear are built up in the blood. And it's only until the later stages of the disease that these toxins can cause symptoms. So things where you feel unwell, so nausea, vomiting, itchiness, restless legs, those types of things. But you can have over 50% of your kidney function lost and have absolutely no symptoms whatsoever. So identifying kidney disease through routine blood and urine tests is important so you can diagnose kidney disease early and start therapies. So specifically, there's 2 tests that we routinely use in clinical practice to identify and stage and prognosticate kidney disease. So the first test is called serum creatinine. Creatinine is a protein that's made by your muscles, and it's generated and put into the blood. So the kidneys filter the creatinine. So if the kidneys aren't filtering the blood properly, the creatinine level builds up in the blood. And you make a specific amount of creatinine every day depending on how old you are, your race, ethnicity, if you're a man or you're a woman. So basically things that can affect your muscle mass. The second way to identify kidney disease is if there's any protein in the urine. So there's different ways to measure and quantify protein in the urine, which should not be there. The main protein in the urine is called albumin. So the test that we do is testing the urine for albumin relative to creatinine. So we use both of those tests to identify kidney disease and stage kidney disease and decide on your risk and need to see if you need to see a kidney doctor, short or long term.
Okay, thank you. That gives me a better idea about what kidney screening is. Now, you mentioned that, those with any kind of kidney issues, the symptoms might not show up right away until it is much later in the kidney failing. So could you tell us about what kind of people, like, is it adults? What kind of people you want to be involved in the kidney screening?
So the project focuses on First Nations adults in Manitoba from the 4 communities that I mentioned before. And to be eligible to participate in this study, you can't have established kidney disease already. So people that have had these blood and urine tests in the last 2 years, that have a diagnosis of chronic kidney disease or have a diagnosis of kidney failure, which includes dialysis or transplantation, are not eligible for the study. So we're looking for people without established kidney disease that are at risk at developing kidney disease. Most people that have a diagnosis of diabetes or hypertension, or so high blood pressure, should be screened yearly by their primary care physician or their circle of care for kidney disease. But we know a lot of that doesn't necessarily happen for different barriers. But we're not just interested in people with diabetes or hypertension, we're interested in all adults. Because it's been shown that 1 in 3 First Nations adults here in Manitoba have chronic kidney disease, and very few people are actually aware of that.
Wow, that is a very eye-opening statistic. So with that, we want to encourage everybody to keep an eye out for information in your community about kidney screening, and that will be through the local health center, I understand, and or healthcare provider, wherever that is for you in your community. Is there anything else that you wanted to share, Dr. Collister, about this project?
So we'll be entering communities in the fall of 2024. So visiting with the medical directors and chief and councils and community members to give presentations and be available to answer any questions related to kidney health, disease screening, and complications. We will be sending mail-outs to eligible participants. So this research study is a clinical trial that's comparing 2 different ways of screening. So we flip a coin and there's a 50% chance that you're allocated to one strategy versus the other strategy. In both strategies, you do have the opportunity to get screened. It's just done differently. So the first strategy is we send out a letter telling you to go see your circle of care, so the nursing station primary care physician, or whoever provides primary care in the community, to go get your kidneys checked with the blood creatinine test and the urine albumin to creatinine ratio test. The other strategy is giving direct information about the study as well as requisitions in the mail for those tests. So not relying on that circle of care to order those tests. In both arms, the results of the test are used to triage and risk stratify. So we use something called the kidney failure risk equation to identify patients at different risk strata and arrange follow-up as appropriately.
Okay, so what you were just talking about, your second part of your strategy, just to kind of make it a little bit understandable. When you're talking about a requisition, are you talking about the forms that people would receive and then it's upon them to go to a lab to get that tested?
Yeah, exactly. So
Okay.
it's the same paper laboratory requisition or form that your doctor normally ticks off different investigations and tests, either before or after your clinic visit. So both of the requisitions for the serum creatinine test and the urine albumin to creatinine ratio test, the ways to screen for kidney disease, are directly provided to you in the mail. And then within 3 months, you have time to go either to the lab in your community, a lab at a larger center, or even, a lab in a major city if you're there for another reason to get these tests done.
Okay, great. Well, I'd like to thank you very much for the information you shared today, and we encourage everyone listening today to keep an ear out for more information, and some of you may be receiving some information in the mail as well about this project. So please keep your ears and eyes open for more information about kidney screening and kidney health. Thank you.